Most people trying to eat healthy are unknowingly damaging their kidneys every single day. Not with junk food, not with alcohol, with something sitting right in your kitchen, something you probably used this morning. I'm Dr. Eleanor Hayes, an internal medicine physician, and after 20 years of treating patients just like you, I've watched this one dietary habit quietly accelerate kidney decline in people who thought they were doing everything right. Today, I'm going to tell you exactly what it is, why it's so damaging after 50, and what the research says you can do about it. Stay with me, because point number 4 surprises almost every single one of my patients. Before we dive in, I want to give you one simple concept I'll come back to throughout this entire video. I call it the silent load. Your kidneys are two of the hardest working organs in your body. Every single day, they filter around 200 liters of blood. They regulate your blood pressure. They balance your minerals. They remove waste. But here's what most people don't realize. Kidneys don't send pain signals until they've already lost a significant portion of their function, sometimes 50% or more. So the damage builds silently, the load accumulates quietly, and by the time most people find out there's a problem, the problem has been growing for years. That's the silent load. And today we're talking about what's feeding it, one kitchen staple at a time. Number 1, excess sodium, and not where you think it's coming from. Here's where I want to challenge something you probably believe. Most people hear too much salt and they picture the salt shaker on the dinner table. So they stop shaking, they feel good about it. Problem solved. But in my clinical experience, that's one of the smallest sources of sodium in the average American diet. The real culprit is processed and packaged food. Bread, canned soups, deli meats, condiments, even cottage cheese marketed as healthy. Research consistently shows that roughly 70 to 75% of our sodium intake comes from processed foods, not the salt we add ourselves. Now, why does this matter so much after 50? Here's the science. When sodium levels in the blood rise, your kidneys work to filter and excrete the excess. That process requires effort. It requires pressure. Over time, chronically high sodium intake is strongly linked to increased glomerular pressure. That's the pressure inside the tiny filtering units of the kidney. And research suggests that contributes to progressive kidney damage, especially in people who already have slightly reduced kidney function, which is common after age 50. Here's what I tell my patients. Your kidneys at 60 are not the same as your kidneys at 30. Their reserve capacity is smaller. The silent load is already higher. So what your body once handled with ease now takes more effort. I had a patient, a gentleman in his early 60s, who was eating what he genuinely believed was a healthy diet. Grilled chicken, soups, store-bought sauces. But his sodium intake was astronomical because he wasn't reading labels. Once we addressed that, his blood pressure numbers and kidney function markers both improved meaningfully. The smart move: start reading sodium on nutrition labels. Aim for under 2,300 milligrams per day, and many kidney health specialists recommend closer to 1,500 milligrams if you're over 50 or have any early kidney concerns. Ask your doctor what's right for you. Number 2, excess protein supplements. The healthy habit that isn't always healthy. Stay with me here because this one frustrates a lot of my patients when I first bring it up. Protein is essential. I am not telling you to avoid protein. But there is a growing trend, especially among adults over 50 who are trying to preserve muscle, of consuming very high-dose protein powders and supplements daily. And the research on what this does to kidneys is worth understanding. Here's the common belief. More protein means more muscle, more strength, better aging. And to a point, that is true. But kidneys are responsible for processing the metabolic waste products of protein breakdown, primarily a compound called urea. When protein intake is consistently very high, research suggests the kidneys face a sustained increase in their filtration burden. In people with healthy, fully functioning kidneys, this is generally manageable. But here's the nuance. Studies indicate that a significant percentage of adults over 50 have mildly reduced kidney function without ever knowing it. And for those individuals, chronically excessive protein intake may accelerate the decline. This is the silent load, again, invisible, accumulating, never painful until it's serious. The practical takeaway isn't to stop eating protein. It's to be thoughtful. Whole food protein sources, fish, eggs, legumes, lean poultry, are metabolized differently than concentrated protein isolates, and the dose matters. Most adults over 50 do well in a range that your physician or a registered dietitian can help you personalize. If you're currently using daily high-dose protein supplements, it is worth asking your doctor to check your kidney function, specifically your eGFR and creatinine levels. I'll explain those at the end. Number 3, chronic dehydration, the invisible kidney stressor. This one sounds obvious. Drink more water. You've heard it 100 times. But here's what most doctors don't have time to explain in a 10-minute visit. Chronic, mild dehydration is one of the most underappreciated contributors to kidney stress in adults over 50. As we age, our sense of thirst becomes less reliable. Research has shown that older adults have a reduced thirst response, meaning your body may be underhydrated before you feel thirsty at all. Your kidneys need adequate fluid to flush waste efficiently. When fluid intake is chronically low, compounds like uric acid and calcium oxalate become more concentrated, leading to higher kidney stone risk and increased stress over time. The kitchen connection? Many adults are replacing water with coffee, tea, and diet sodas, some of which actually add to the kidney's workload. The guidance is simple. Pale yellow urine is your easiest daily checkpoint. If it's dark yellow consistently, your kidneys are working harder than they need to. Number 4, and this is the one that surprises most of my patients, phosphorus additives in processed foods. Natural phosphorus in nuts and whole grains is handled well, but there is a form added to processed foods as a preservative. Look for anything ending in phosphate. Research in nephrology shows inorganic phosphate additives are absorbed at a much higher rate, up to 90%, compared to around 40 to 60% from whole foods. Where are these hiding? Fast food, processed cheese, dark colas, and many instant foods. This represents a meaningful, invisible addition to the silent load. Number 5, over-the-counter pain medications used too frequently. This lives in your kitchen cabinet, and it's just as important as your pantry. What most people don't know is that frequent use of NSAIDs, like ibuprofen or naproxen, is a well-documented cause of kidney damage. It's often dramatically underdiagnosed. NSAIDs affect prostaglandins that help regulate blood flow to the kidneys. Chronic use can reduce that protective flow, contributing to silent damage over time. I have seen patients taking ibuprofen daily for years, unaware it was affecting their kidney numbers. Please talk to your doctor about safer alternatives for chronic pain. Number 6, ultra-processed foods and the compound effect. The real danger is the compound effect. Ultra-processed foods often contain high sodium, phosphate additives, and artificial colors simultaneously. This is the silent load in its most concentrated form, but small, consistent changes compound just as powerfully in the positive direction. Replacing even a few processed meals per week creates a measurable reduction in your kidney's daily workload. Before I close, I want to give you something practical. Here are 3 questions worth bringing to your next doctor's visit. 1. Can you check my eGFR and creatinine? I want to understand my kidney function baseline. The eGFR is the standard measure of how well your kidneys are filtering. 2. Given my diet and medications, is there anything specific I should be watching for regarding kidney health? This opens the door for a personalized conversation. 3. Are there any supplements or over-the-counter medications I should be cautious about? This applies to NSAIDs, certain herbal supplements, and even certain high-dose vitamins. Your kidneys work silently every moment to keep you in balance. What they need from you is simple, more of the habits that give them room to do their job. The patients who age the best aren't the ones who are perfect. They're the ones who stay curious and make steady, informed choices over time. You're already doing that because you're here. If this video gave you something useful, please subscribe. Share this with someone you care about. Take care of yourself, and I'll see you in the next one. This video is for educational purposes only and does not replace personalized advice from your own physician. Always consult your healthcare provider before making changes.